Test English channel test. Natasha, can you hear us? If you do, can you open the camera? Test 1 2 1 2 test for the signer. Test 1 2 1 2.
I'm speaking in the English channel. Let us know if you can hear us. Natasha, I'm speaking in the English channel. Can you hear us now? English channel. Okay, thank you very much.
إعلان مهم. 重要提示
Important announcement.
Message important.
Важное объявление.
Anuncio importante.
يرجى من المتحدثين الكرام إلقاء بياناتهم بسرعة معقولة لضمان ترجمة فورية وافية وعالية الجودة. 为了帮助口译准确完整传递发言信息，请代表发言时语速不要过快。
Speakers are kindly reminded to deliver their statements at a reasonable pace to ensure complete and quality interpretation.
Il est rappelé aux orateurs qu'ils doivent présenter leur déclaration à un rythme raisonnable afin de garantir une interprétation complète et de qualité.
Напоминаем ораторам, что для того, чтобы устный перевод был полным и качественным, необходимо выступать в умеренном темпе.
Se ruega a los oradores que pronuncien sus declaraciones a un ritmo razonable para garantizar una interpretación íntegra y de calidad.
Financing and primary health care reforms, with technical support from the WHO, the World Bank, UNICEF, UNFPA, CHAI, and other partners. These reforms seek to strengthen domestic resource mobilization, improve efficiency and equity of health financing, and reinforce PHC as a foundation for university. Government-led process involving the Ministry of Health and Sanitation, the Ministry of Finance, and other sector ministries, development partners, professional associations, and civil society under the guidance and oversight of the highest levels of government. This collaborative approach has ensured that the reform agenda is nationally owned while benefiting from international technical cooperation and strategic partnerships. Like many these developing the importance of sustained technical cooperation and international solidarity. Allow me to highlight some of the key elements of these ongoing reforms. Health financing. Government is advancing reforms to increase domestic resource mobilization, level. Efforts are also underway to strengthen institutional arrangement to support universal health coverage. There's a renewed focus on defining and regularly updating unified health benefit packages to ensure they are affordable, coherent, and responsive to populations in need. Also, there are efforts people as well as external donors, which is unsustainable. Efforts are underway to better coordinate domestic and external financing through harmonized pooling mechanisms. This increases reduces resources reach frontline delivery points. Sierra Leone is strengthening systems for universal health coverage through institutional arrangements for strategic purchasing. We are advancing institutional reforms to improve services delivery. At the heart of our reform is a renewed commitment to stronger PHC as a foundation of health systems. Reform is ongoing to define norms and standards for primary health care. Deliberate commitment to upgrade the infrastructure and services in health facilities, pathways towards realizing the right to health. We hope that Sierra Leone's experience will contribute to peer learning among countries similarly health systems for all. We remain committed to working with all our partners to advance universal health coverage and ensure that the right to health becomes a lived reality of every citizen. And we thank
Thank you, Mr. President. Madam Deputy High Commissioner, distinguished panelists, excellencies, and distinguished delegates. Thank you for the opportunity to contribute to this important discussion. I'm pleased to be here today to share the Global Fund's perspective instruments. Non-discrimination is an immediate legal obligation and is essential for advancing the right to health. Today, this obligation is being tested in multiple and compounding ways, including a worrying resurgence of stigma, discrimination, and anti-rights narratives that actively obstruct access to services for those most marginalized, including those requiring lifelong chronic disease management. While challenges in this context, technical cooperation and capacity building are not peripheral to the realization of the right to health. They are among its most important operational tools. The Global Fund partnership access them. Diagnostics do not control epidemics if people are afraid to be tested, and treatment programs cannot succeed if people face discrimination in health facilities or fear arrest, violence, or exclusion when seeking care. Through our Breaking Down Barriers initiative, launched in 2017, expand health-related legal literacy and access to justice, strengthen community accountability mechanisms, address gender-based violence and discrimination, and support reforms that help create enabling legal and policy environments for health. But financing these programs alone is not enough. If everyone is to have access to quality health services, we must also invest in building capacity of the people and systems that make this possible. For us, capacity building does not mean a one-off training or a workshop. It means sustained accompaniment throughout implementation. It means working with It also means empowering those most affected to meaningfully participate in program design, monitor whether services are accessible, document what is not working, and bring that evidence back to decision makers. I'm pleased to be sitting beside His Excellency Barry as Sierra to strengthen the conditions for those activities to actually have impact. We see similar lessons elsewhere. In Thailand, the recent expansion of breaking down barriers has been part of stronger donor cooperation. Ukraine, community organizations supported through Global Fund grants have played an essential role in maintaining access to HIV and TB services despite conflict, displacement, and worked closely with health workers and law enforcement in 46 municipalities to reduce stigma and discrimination in healthcare and justice settings, resulting in more respectful and inclusive services for people living with HIV and key populations. In Côte d'Ivoire, to the mainstream of HIV, TB, and malaria responses. Indonesia has shown that lasting change comes from embedding the agenda within institutions, professional systems, and governance structures that can continue functioning long after a specific grant has ended. Institutional backing to provide discrimination-free care, and institutions beyond the health sector, including those working on gender, social protection, justice, and human rights, need to be engaged so that barriers are addressed where they arise. As external assistance, health workers and improving access to justice will protect the effectiveness and sustainability of investments in medicines, diagnostics, and service delivery. Technical cooperation must therefore enable countries to plan for sustainability of this work. It also means protecting and gradually sustaining high-performing community-led programs so that gains are not lost when external support and funding changes or ends. So my message today is simple. If we're serious about ensuring non-discriminatory access to health services, technical cooperation, and capacity building, double down on these two areas to accelerate the fight against the world's deadliest infectious diseases and shape a healthier, more equitable world for all. Thank you.
Thank you. Director of Physicians for Human Rights.
I wanted to thank the Office of the High Commissioner for convening this important discussion and for highlighting the importance of capacity building and technical cooperation in responding to a global health polycrisis that combines serious risks to human rights and right to life and the right to health of people around the world. Physicians for Human Rights has warned about how the intersection of conflict, displacement, global health assistance, Congo, and neighboring areas. In the Democratic Republic of Congo, as elsewhere, the situation is made significantly worse by escalating attacks on healthcare providers with near total impunity. 10 years after the adoption of Security Council Resolution 2286, which condemned attacks on healthcare during conflict, the Safeguarding Health in Conflict Coalition, of which PHR is a founding member, has documented more than 18,000 incidents of violence against So this discussion is especially timely because several processes are converging. The 10th anniversary of Security Council Resolution 2286 has renewed new efforts in Geneva to bring the protection of healthcare more fully into the work of the Human Rights Council through a proposed draft resolution on protection of healthcare in conflict. The Human Rights Council has an rights and public health harms caused by such attacks during this polycrisis. Because attacks on healthcare are system-level shocks undermining health health workers also bear the brunt, facing heightened security risks and increased workloads amid personnel shortages. The obligation to respect, protect, and fulfill the right to health therefore operates only immediate civilian harm, but also foreseeable downstream health consequences, including interrupted treatment, maternal and neonatal harms, chronic disease impacts, disability-related harms, mental health consequences, and and essential hospital functions, and caused health harms beyond clinical settings, particularly for vulnerable populations. In Syria, attacks on healthcare facilities affected whether and how women sought reproductive and maternal care. In Gaza, attacks on healthcare, restrictions on supplies, destruction of infrastructure, and deprivation of basic necessities have combined to produce severe harms for pregnant women, newborns, and other groups with urgent health needs. This is where capacity building and technical cooperation play a critical role. healthcare into military doctrine, weapons reviews, and arms transfers. This should include attention to the foreseeable reverberating effects of attacks on civilians. A medical facility permits attacks on the entire facility, or that medical supplies can be prevented from entering into conflict zones under dual-use restrictions. Significant health harms, that harm must be part of the assessment. Technical cooperation should also strengthen accountability pathways, including support can help ministries of health, defense authorities, emergency services, humanitarian actors, and other government sectors to coordinate prevention Third, capacity building should support healthcare workers themselves. Health workers are protected under international law. Technical assistance should help protect them from violence, threats, coercion, and safety and safeguards against dual loyalty pressures, particularly in occupation or militarized health setting. The burden should never lift onto health workers or patients to protect themselves from unlawful attacks. Fourth, documentation must be strengthened. OHCHR is mandated to help member states, national human rights institutions, UN mechanisms, and civil society document not only incidents themselves, but also their longer-term health impacts. Attacks on healthcare are now more visible in international reporting than they were a decade ago. Commissions of inquiry, fact-finding missions, UN agencies, civil society organizations, and investigative bodies increasingly document attacks on healthcare and their impacts, which reflects conflicts and attacks around the world. But these mechanisms need global cooperation, along with political backing, resources, access, and follow-through. As a practical next step, PHR would encourage closer coordination between the Office of the High Commissioner for Human Rights and the World Health Organization on the human rights dimensions of the current health polycrisis to bring together public health, human rights, humanitarian, and accountability actors who too often operate in parallel. By combining WHO's technical and normative role on health systems with OHCHR's mandate to assess rights impacts and advance accountability, we could help move the international response toward a more coherent, rights-based approach. Thank you for your time.
I have the honor now to give the floor to Ms. Maria Malo for a video message.
Honorable colleagues, thank you for inviting us to share our work. My name is Maria Malo, Chair of the Steering Committee for the Digital Health and Rights Project. We were established in 2019 as a consortium of social scientists, human rights lawyers, health and rights advocates, and global and national networks of people living with HIV, a total of 10 organizations across 4 continents. Our work takes a transnational participatory action research approach grounded in community advisory teams established in Colombia, Ghana, Kenya, and Vietnam. The digital transformation is occurring rapidly, and many communities are already seeing their digital rights at risk, including through privacy violations, technology-facilitated abuse, and digital exclusion. However, As the world adopts new digital tools, this rapid pace of development also leaves a significant gap in technical capacity to support human rights. Technical capacity building should go beyond digital skills alone. It must equip institutions and practitioners to develop, deploy, and govern digital technologies in ways that advance equality, privacy, accountability, and meaningful participation while protecting human rights. In response to this, we have been working on building institutional and local capacity to contribute toward our vision of a world in which everyone can access their digital rights. We conducted research with the World Health Organization that demonstrated the lack of attention to digital rights from member states. None of the 20 national digital health strategies reviewed had reference to gender, equity, or human rights. We are continuing work with the WHO to build rights into the new global strategy on digital health, better equip member states with normative guidance on digital rights, and ensure there is capacity to meaningfully bring those affected into the conversation. We have also championed digital literacy and what we term digital empowerment, the knowledge, skills, and competences people develop to advocate for their rights in the digital age, within institutions and communities. This work includes developing a digital literacy hub and a massive open online course on digital rights that has to be equipped with the skills and capacity to engage in a digital world, including entering digital policy spaces that respond to their needs. The Digital Health and Rights Project puts young people at the heart of the project, giving them opportunities to engage in capacity building at a local level and share their learnings to global institutions. For example, in Vietnam, our community advisory team evolved into a rapid response network to protect young people from digital harm. In 2024, they collaborated with Samsung and local authorities to remove harmful HIV misinformation that had been shared about one of the company's members of staff. This community action prevented stigma and demonstrated concrete actions that can be adopted to mitigate the spread of misinformation in the workplace. The team also fostered interdisciplinary coordination through projects funded by youth microgrants, such as the Run for Life Marathon, which reached 1,000 people. They integrated digital capacity building into this event to educate participants on privacy and safe health-seeking behaviors. This work is important because in Vietnam, stigma interacts with digital barriers, including surveillance and data protection gaps to deepen inequality. Many marginalized young people avoid accessing health services due to fears of doxing or identity disclosure. Our Vietnam Community Advisory Team is continuing this work, conducting outreach and digital literacy interventions to address these issues. They say that by enhancing digital health literacy, we are not just teaching technical skills, we are building the digital trust necessary for young people to claim their right to health in an increasingly modernized world. A second example comes from Ghana, where our research revealed a deeply troubling reality. Young people, particularly those living with HIV and sexual minorities, are experiencing technology-facilitated abuse at alarming rates. Surveillance, blackmail, harassment, and the weaponization of health information online are not isolated incidents. They are systemic patterns that erode trust, silence people, and deny them access to the health services they need and deserve. Down, but from within affected communities themselves. Our community advisory team produced a community podcast series where young people spoke in their own voices about digital rights, online harm, and what safety in digital spaces should look like. They also conducted peer outreach and community training, equipping young people with the knowledge to recognize, report, and resist technology-facilitated abuse, and engaged media journalists from national television and print to amplify these issues to broader Ghanaian society. Finally, they connected research findings directly to national advocacy, engaging policymakers on Ghana's AI strategy and data protection frameworks to ensure marginalized voices shape the rules that govern digital spaces. Describing this work, they said, what we built is not just awareness, it is agency, the capacity of young people to advocate for their own digital rights, to hold institutions accountable, and to participate meaningfully in the governance of the technologies that affect their lives. That is what technical capacity building must look like in practice. We are committed to continuing this work, and we are grateful for your support in doing this. To finish, I would like to share my gratitude for inputs into this statement from two young people, Minan and Solomon, and thank you for the opportunity to share the work of the Digital Health and Rights Project.
Okay, thank you. Excellencies, distinguished representatives, we will now proceed with the first segment of the list of speakers. All intervention from the floor are limited for 1 minute and 30 seconds. The list of speakers is now closed. I now give the floor to the distinguished representatives of the European Union.
Thank you, Mr. President. The EU thanks the OHCHR for organizing this panel discussion. The highest attainable standard of physical and mental health is a human right, and health is a prerequisite for sustainable development. EU is committed to policy coherence and a human rights-based approach, and together with its partners plays the leading role in advancing global health. Our contributions go beyond the health sector itself and include, among other areas, such as climate and environment, WASH, education, research and innovation, food security, as well as social protection. Team Europe initiatives under the Global Gateway help to improve health security and increase the resilience of health systems around the world. The EU Global Health Strategy is a key component of Global Gateway. We collaborate with global, regional and bilateral partners to build sustainable health systems to advance universal health coverage, apply the One Health approach, fight diseases and advance equitable access to healthcare by funding localized vaccine and medicine manufacturing infrastructure development and pandemic preparedness. Distinguished panelists, how can a non-discriminatory access to essential health services be best ensured, and what are the most efficient ways to use technical assistance to guarantee access to these services to those in vulnerable situations? I thank you.
Thank you. I now give the floor to the distinguished representative of Portugal on behalf of the community of Portuguese language countries.
President, it's an honour for me to make this statement on behalf of the community of Portuguese-speaking countries. Given the current international context, no country can address alone the challenges facing achieving the right to health. International cooperation is still important to provide effective, equitable responses showing solidarity. Resilient and accessible health systems and non-discrimination in access to services are essential also for accessing care in order to achieve the right to health, social cohesion, stability and sustainable development. We'd like to highlight the CPLP's Strategic Plan for Health Cooperation 2023 to 2027. It is a commitment in terms of horizontal cooperation to consolidate sustainable development, good governance of our respective national health systems and global health. A human rights approach is essential in this context, and that is why we'd like to recall the resolution on technical assistance and training that the CPLP countries are submitting in this session of the HRC. This initiative recognises that international cooperation is important to strengthen the capacity of states to protect human rights, prevent violations, and also to implement Agenda 2030. It also expresses the commitment of the CPLP in cooperating with the Office of High Commission for Human Rights and with human rights mechanisms whose recommendations and support we greatly appreciate. Thank you.
Thank you. I give the floor to a distinguished representative of Sudan on behalf of the Group of Arab States.
Thank you, Mr. President. I have the honor to make this statement on behalf of the Arab Group. The Arab Group appreciates the organization of this panel discussion, and we thank the panelists for their valuable interventions. The Arab Group reiterates that in physical and mental health in primary health care through programs and through promotion of national policies, including within the framework of the League of Arab States. The Arab Group expresses its concern as to the catastrophic deterioration of the right to health in the OPT, as well as Lebanon, because of the systematic practices of the Israeli occupation that targets health facilities and health workers. They undermine access to assistance and services. This exacerbates the suffering of civilians, notably women and children, and also impedes their right to attain high standards of physical and mental health. We call for effective measures, including providing all support and technical assistance to protect health infrastructure in the OPT and building resilient health systems and ensure the right of the Palestinian people to life, as well as to health in line with the international human rights law and the international humanitarian law. I thank you, Mr. Chair.
Thank you. I now give the floor to the distinguished representative of Kenya on behalf of a group of African states.
Thank you, Mr. President. I have the honor to speak on behalf of the African Group. We thank the United Nations Deputy High Commissioner for the Human Rights and the federal speakers for their briefing on this crucial topic. The African Group reaffirms that the enjoyment of the highest attainable standards of physical and mental health is a fundamental right of every human being. We are deeply concerned about the persistent and growing disparities between developed and developing countries in access to health, essential treatments, and medical technologies. For African countries, the effective realization of these rights requires technical cooperation and tangible capacity building. Africa faces major structural changes, including lack of infrastructure, brain drain, and over-reliance on imports for essential medical products. In this context, the African Group calls for concrete and coordinated actions by the international community, namely the transfer of technology and know-how, support for local health systems, and predictable and sustainable financing. We also stress the importance of adopting human rights-sensitive approaches in preparing for and responding to future global health emergencies, placing international solidarity at the heart of public policies. The African Group reaffirms its commitment to work with OHCHR, the World Health Organization, and all partners to overcome these obstacles. The full realization of the right to health requires effective and inclusive multilateralism. I thank you.
Thank you. I give the floor to the distinguished representative of Bahrain on behalf of the Cooperation Council for the Arab States of the Gulf.
Thank you, Mr. Chair. The GCC countries welcomes the organization of this panel on the role of capacity building and technical cooperation supporting countries for the implementation of the right of every person to the highest attainable standard of physical and mental health. We treat that the right to health is a pillar for the enjoyment of all human rights and promoting health systems. This requires a comprehensive approach that takes into account determinants of health and provides universal health coverage and preparedness for emergencies and ensure access to primary health services. This discussion comes at a time countries are facing increasing challenges and health and physical needs in cases of displacement and conflict. We are concerned about the increasing attacks against facilities and health workers, and we reiterate the need to respect and protect medical facilities and health workforce in line with international law and international human rights law. The GCC states reiterates the need to invest in innovation and digital transformation. at the level of healthcare to improve services and expand access to such services while protecting data and privacy and not to leave anyone behind. Thank you.
Thank you. I give the floor to distinguished representatives of the Maldives on behalf of a group of countries.
President, I have the honor to speak on behalf of an informal group of SIDS as listed on the extranet. In SIDS, the enjoyment of the right to health continues to be affected by a range of challenges, including the impact of climate change and natural disasters on health systems, a high burden of non-communicable diseases, and increasing exposure to public health emergencies and other external shocks. Addressing these challenges require resilient, equitable, and people-centered health systems, strengthened through primary health care and universal health coverage, including financial instruments built within regulatory frameworks. It also requires integrated approaches that incorporate mental health and psychosocial support across health policies and programs, including through community-based services and emergency preparedness and response. At the same time, our efforts are shaped by structural constraints, including geographic dispersion, small populations, and limited economies of scale. These factors place significant pressure on health workforces, health information systems, and medical supply chains, increasing vulnerability to external shocks, while also limiting fiscal space available to strengthen health systems. In this context, we call for demand-driven and country-owned technical cooperation and capacity
I give the floor to the distinguished representative of Trinidad and Tobago on behalf of a group of countries.
Thank you, Mr. President. I'm pleased to deliver this statement on behalf of the CARICOM group in Geneva. We thank the Deputy High Commissioner and the panelists for their insightful contributions. As the Caribbean region continues to grapple with the cascading effects of climate change, natural disasters, exogenous shocks, NCDs, and other public health challenges and emergencies, we highlight the critical role of technical cooperation and capacity building, particularly for SIDS such as ours. The graduation of countries within the region, notwithstanding inherent and persistent vulnerabilities, and the attendant limited access to ODA, also amplify the need for innovative and targeted approaches to technical cooperation and capacity building across the health spectrum. In this vein, the region values its ongoing cooperation with agencies such as WHO, PAHO, and UNDP. For example, the CARICOM PAHO initiative entitled the CARICOM Youth Mental Health First Aid Program empowers young people and youth workers to offer meaningful support during mentally challenging circumstances. Notably, some participants in the program were among those providing mental health support to persons in the aftermath of Hurricane Melissa, which ravaged Jamaica in October 2025. We accordingly highlight the importance of enhancing indigenous, youth-oriented approaches in technical cooperation and capacity building efforts, and the need for sustained financing to enable such assistance. I thank you.
Thank you. I give the floor to the distinguished representative of China on behalf of a group of countries.
Mr. President, it is my honor to speak on behalf of 65 countries on accessibility through AI. Accessibility is of vital importance for the enjoyment of all human rights by all. We should harness the potential of AI to improve accessibility and implement the resolution on accessibility for all to the full enjoyment of all human rights. First, we should adhere to a development-oriented approach. By promoting accessibility through AI, we inject vitality into high-quality development. Second, we should promote AI for good and for all. In promoting accessibility, AI should be people-centered, enable all to jointly build and share the fruits of social development. Third, we should uphold fairness and impartiality to ensure equal accessibility for diverse groups and all countries. Fourth, we should advocate universal benefits and inclusiveness, bridge the digital divide and development imbalances, and promote the exchange on good practices of accessibility for all at the regional and international levels in the context of AI. Thank you, Mr. President.
Thank you. I give the floor to a distinguished representative of the Federated States of Micronesia on behalf of a group of countries.
Thank you, Mr. President. I have the honor of delivering this statement on behalf of 8 beneficiary countries of the LDC-CIS Trust Fund participating in this session. We are confronting increasing public health challenges ranging from the rise of non-communicable diseases to recurring outbreaks that can quickly overwhelm small and under-resourced health systems. These realities make it difficult to sustain essential health services and to expand coverage to ensure that no one is left behind. In this context, technical cooperation and capacity building are vital. They strengthen national institutions, support responsible digital transformation, support the promotion of health and well-being while fully respecting human rights. Call for technical cooperation that is steady, responsive to national priorities and contexts, and accessible to all countries facing structural vulnerabilities. I thank you.
Thank you. I give the floor to a distinguished representative of
right to health, assistance, cooperation, and international solidarity are fundamental components in efforts to make effective the right to health in all countries. They have helped save millions of lives. Adverse repercussions of UCMs, including blockades, economic embargoes to the right to health. We call for the elimination of such measures which are counter to the UN Charter and to international law. These should never be exploited as instruments of political or economic coercion. We will continue to support efforts to expand technical cooperation and contribute to capacity building of states in full, effective exercise of the right of all persons to health. Thank you.
Thank you. I give the floor to the distinguished representative of Ecuador.
Gracias, señor presidente. Thank you, President. My delegation is grateful to the panelists for their valuable presentations and reaffirms that the right of all persons to the enjoyment of the highest level of possible of physical and mental health demands effective, dynamic, timely international cooperation to bolster the capacities of states and in line with their national priorities. Ecuador has promoted a model of inclusive, decentralized intercultural health, which faces a growing demand on its public health system. This requires greater cooperation based on shared responsibilities among the states concerned and international cooperation agencies. In that regard, my delegation highlights among its priorities to orient cooperation, its cooperation with OHCHR and WHO, among others. We highlight the importance of technology transfer, including medical technology, telemedicine, and access to knowledge for the local production of essential medications. Similarly, this cooperation should take into account the need to integrate mental health into primary medical care, with services accessible at all levels of government and at community level, while bolstering ancestral knowledge of indigenous peoples and people of African descent. Finally, we urge all all countries and bodies, relevant bodies, to channel non-reimbursable financial resources to guarantee the right to healthcare for all people without leaving anyone behind. Thank you.
Or to the distinguished representative of Luxembourg.
Thank you, President. Technical cooperation and capacity building of states are a key lever in advancing the right of every person to enjoy the best level of physical and mental health possible. Partnerships responding to national priorities bolster healthcare systems and improve accessibility, financing, and quality of services for all populations with the goal of universal healthcare coverage. Luxembourg actively bolsters institutional, organizational, and individual capacities of the health sectors of its state partners, including in Laos, Mongolia, Senegal, and Cabo Verde. In Mongolia, for example, Luxembourg has supported the government in sustainably bolstering its cardiovascular healthcare services, with particular emphasis on telemedicine, which is crucial in such a vast and country with low population density. This has allowed the establishment of a national telemedicine network covering the whole of the country, as well as the development of local capacities in cardiac surgery and in intravascular interventions and treatments that were exclusively available abroad. Technical partnerships continue to support these capacities to guarantee safe, autonomous functioning of these services. We are convinced that technical cooperation and capacity building can only be fully effective when they are part of a long-term autonomy perspective of systems, of organizations, and of stakeholders within the countries involved. Thank you.
To the distinguished representative of Thailand.
Thank you, Mr. President. Thailand attaches great importance to its technical cooperation and capacity building to advance the right to health. We are actively engaged in South-South and triangular cooperation with neighboring countries to strengthen cross-border public health. Our own partnership focuses on strengthening local coordination, building the capacity of health professionals and frontline workers, improving access to health services and referral systems, and exchanging good practices. Through more than 2 decades of sustaining universal health coverage, Thailand has shown that quality health services can be delivered without financial hardship. One example is the integration of comprehensive sexual and reproductive health services including HIV prevention, into our UNHRC framework, contributing to a significant decline in maternal mortality. The decentralization of mental health care through primary health systems and village health volunteers also help narrow the treatment gaps through early screening and psychosocial support in rural areas. These experiences show that rights-based health policy can save lives. Thailand stands ready to deepen technical cooperation with partners in building resilient and inclusive health system. I thank you.
Thank you. I give the floor to the distinguished representative of Zambia.
Thank you, Mr. President. Zambia thanks the panelists for their valuable insights. Zambia associates itself with the joint statements to which it is a party. The progressive realization of the right of everyone to the highest attainable standard of physical and mental health requires strong national institutions, empowered communities, and sustained partnerships. Technical cooperation makes an important contribution by strengthening national capacities in a manner that responds to each country's priorities and circumstances. In Zambia, cooperation with United Nations agencies and development partners has supported the expansion of primary health care, strengthened the health workforce, improved maternal and child health services, enhanced disease surveillance, advanced digital health systems, and accelerated implementation of the National Health Insurance Scheme. These achievements demonstrate the value of partnerships founded on national ownership and shared commitment. At the same time, technical cooperation should increasingly be viewed as a two-way exchange of knowledge rather than a one-way transfer of expertise. It should create opportunities for states not only to receive support, but also to share the knowledge, innovations, and community-based health practices that have sustained their peoples for generations. In this regard, helping states identify, preserve, and further develop indigenous knowledge systems can unlock existing national capacities, enrich our collective understanding, and contribute to more resilient, culturally responsive health systems. I thank you, Chair.
Thank you. I give the floor to the distinguished. I will now turn to the list of speakers for national human rights institutions and non-governmental organizations. And I give the floor to the representative of International Planned Parenthood Federation.
Thank you, Mr. President. The right to health can't be realized without resources, and in the past year, this have been denied on a vast scale. At least 9 million people lost access to essential care due to the collapse of funding for sexual and reproductive health. Technical cooperation must answer that reality. We call on states and partners to direct capacity building for rights-based and gender-responsive health budgeting that protects essential services, including sexual and reproductive health. Continue ODA commitments, as well as help countries to build sustainable domestic financing, and recognizing health and care workers as human rights defenders of their right to health, especially in conflict situations. The right to health cannot be realized without sexual and reproductive health, rights and justice for all, and without civil society participation in health policies and systems. In this critical moment, we call on member states and stakeholders to center the voices of women, girls, and marginalized communities in all discussions on the right to health, including the UN80 reform and the Global Health Architecture reform. Thank you.
Thank you. I give the floor to the representative of Center for Global Non-Killing.
Beloved human beings, Mr. President, distinguished panelists, excellencies, ladies and gentlemen, everyone everywhere, greetings of healthy human rights. The broad picture, physical health of human beings is improving, maybe not equally enough, but mostly improving. More work is needed for mental health. The mental health of humanity itself, altogether, could be better. Living in fear of war or conflict, of climate disaster, or in discrimination is neither healthy nor coherent for our individual and common future. Humanity is immensely rich in knowledge, in profound feelings and ethics, in huge infrastructures sustaining life, and of course, rich in assets. How this fortune is used for the health and well-being of everyone, for the happy future of our humanity, is a question at stake today. Here are suggestions. For countries concerned, please decriminalize suicides. Humanity should not be a suicidal species, nor punish itself or its members for it. Cooperation to that end is useful, helpful, and needed. Minimum standards of living are a strong driver for good health. Economic and social rights are meant to help us pass from being equal at birth to being equal in living. Please be generous. I have spoken. Thank you, Mr. President.
Thank you. I give the floor to the representative of Instituto Internazionale Maria Auxiliatriz delle Salesiane di Don Bosco for a joint statement.
Thank you, Mr. President. IIMA and VIDIS welcome this panel and its great relevance for youth. Physical and mental health are both fundamental components of the right to health. The online survey we launched in February of this year, which received 1,778 responses, 80% of which were from adolescents and youths across 46 countries on 5 continents, shows that mental health challenges have a detrimental impact on the enjoyment of human rights by young people. Insufficient investment in healthcare, reduced by 19 to 33% in 2025, is further aggravating the situation. Although states have made progress, youth continue to have limited access to support systems, also because of financial barriers. Our voices matter, our experiences matter, our future matters. We therefore call on states to, 1, ensure that youth are partners in drafting and implementing physical and mental health policies. 2, increase domestic investment in youth mental health through integration of health coverage. And 3, guarantee qualified mental health professionals, especially in rural and marginalized communities. Thank you.
Thank you. I give the floor to the representative of Harm Reduction International for video intervention.
Thank you, President. Harm Reduction International and the co-signatories of this statement welcome the panel discussion on technical cooperation and capacity building to advance the right to health. As health budgets come under increasing pressures and international funding for HIV and harm reduction continues to decline, technical cooperation must support states to prioritize investment that deliver the greatest health and human rights outcomes. This is particularly important for people who use drugs, who continue to face significant barriers to healthcare due to stigma, discrimination, and punitive drug policies. Harm reduction is not optional or peripheral. It is an essential component of the right to health. Evidence is clear that services such as needle and syringe programs, opioid agonist therapy, and overdose prevention are cost-effective, life-saving, and indispensable to public health. Yet, in many countries, they remain severely underfunded, while vast resources continue to be allocated to punitive drug control measures, which often have harmful consequences for public health and human rights. We urge states to realign drug policy with public health and human rights by integrating harm reduction into universal health coverage and national health systems, strengthening domestic financing mechanisms, and ensure the sustainability of services. We further call for states and international development partners to ensure the meaningful participation of people who use drugs and community-led organizations in the design, implementation, and evaluation of health policies and programs. Prioritizing health and harm reduction over punitive drug policies is not only good policy, it is a necessary step toward fulfilling the right to health for all. Thank you.
Thank you. I give the floor to the representative of Christian Council International.
Thank you, Mr. President. Distinguished delegates, panelists, on behalf of Christian Council International, I wish to pose two questions to the panel. First, how can we ensure that local capacity building is not compromised by the proliferation of financing mechanisms for pandemic prevention, preparedness, and response? While pandemic preparedness is crucial, the current narrative surrounding pandemic risks should not compromise financing for the world's deadliest diseases. An excessive focus on international vaccine strategies risks overlooking the importance of local capacity building and technical cooperation related to hygiene, nutrition support, and high-burden diseases. Second, what measures can countries take to ensure that cooperation remains in accordance with their legal frameworks? HRC Resolution 6030 affirms that technical cooperation should be in accordance with international human rights law and national legal frameworks. Unfortunately, cooperation in the field of health often includes the promotion of services that contradict these frameworks, especially in relation to abortion and sexual and reproductive health and rights. We wish to reaffirm that there is no international agreed upon definition of these rights, and that to uphold inclusive cooperation, the religious and cultural values of concerned countries need to be respected and promoted. Thank you.
Thank you. I give the floor to the representative of Genève pour le droit de l'homme, Formation Internationale.
Thank you. The WHO reveals that a woman dies every 2 minutes from preventable causes related to pregnancy and childbirth. Within low and middle income countries, women living in poverty, in rural areas, and women facing discrimination based on race, ethnicity, disability, or geographic location die from entirely preventable causes. Approximately 500,000 women and girls live with obstetric fistula worldwide, a devastating childbirth injury affecting women experiencing intersecting discrimination. Untreated obstetric fistula coupled with deep-rooted social stigma leads to cascading violation of human rights, social isolation, family abandonment, and exclusion from community. This violation reflects the absence of human rights-based approach to maternal health. Resolution 60/18 of October 2025 explicitly recognizes that preventable maternal mortality and morbidity are human violations stemming from intersecting discrimination. Technical cooperation and capacity building assume critical importance. States must develop comprehensive national prevention plan, establish maternal mortality surveillance systems, provide mandatory training of all health workers in dignity and non-discrimination, and establish accessible complaint and remedy mechanism at health facility level. We thank you.
Thank you. We will now proceed with the second segment of the list of speakers, and I give the floor to the distinguished representative of Paraguay.
I'd like to thank you for organizing this important event. and thank the panelists for their contribution. For Paraguay, healthcare is an essential component of sustainable development and human dignity. In a global context marked by growing inequalities, fiscal restrictions, and complex sanitary challenges, we reaffirm the importance of international cooperation based on dialogue, respecting national priorities, and sustainable capacity building. Paraguay attributes fundamental value to human life, which deserves to be protected and respected at all times. Therefore, the right to life is guaranteed under the Constitution, and therefore it doesn't recognize termination of pregnancy as a right deriving from personal autonomy or from reproductive rights. My country has promoted a strategy to expand effective coverage and decentralize healthcare services by strengthening family health units, integrated service networks, and new regional hospitals. Among the most top priorities has been expanding maternal and infant healthcare access in rural areas, indigenous communities, and in border areas in the Chaco region, as well as implementation of a mental health law, the adoption of a national policy of mental health, and strengthening action on sexual and reproductive health. Finally, we believe that technical cooperation, when it meets needs identified by states themselves, constitutes a crucial instrument for reducing gaps. Thank you.
Thank you. I give the floor to the distinguished representative of Eritrea.
Thank you, Mr. President. Eritrea has made notable registered strides in improving the health and well-being of its population. Through sustained national efforts, we have expanded primary healthcare services, improved maternal and child health outcomes, and strengthened disease prevention and control mechanisms. These achievements have been realized through strong national ownership, community-based approaches, and policies tailored to our specific context and priorities. These successes demonstrate that durable progress is best achieved when capacity building efforts are aligned with national systems and grounded in local realities. Technical cooperation should serve to reinforce existing national capacities, build on proven approaches, and support long-term institutional resilience, rather than introduce one-size-fits-all models. For developing countries, particularly in the African context, ensuring accessible, equitable, and quality health services remain a fundamental priority, especially in the face of historical challenges and ongoing socioeconomic pressures. Strengthening health systems is not only a matter of policy, but a necessity for resilience and stability. Technical cooperation must therefore be responsive to these realities and support states in delivering essential health services to their populations in a sustainable and nationally driven manner. I thank you, Mr. President.
Thank you. I give the floor to the distinguished representative of Cuba.
President, enjoyment of the human right to healthcare must always be respected. No one can jeopardize the capacities of states to guarantee this right to the population. Nevertheless, the world has witnessed an unacceptable case of violation of those basic principles. The case of Cuba demonstrates this. The US imposes on our country a complete energy siege, in addition to the 60-year economic blockade, which has led to a substantial deterioration of the excellent indicators reached by Cuba. As the Deputy Human Rights Commissioner said a few minutes ago, as a result of the blockade in Cuba, children are dying for lack of medicine and medical equipment. The mortality rate for children has doubled. 100,000 operations have been delayed, including 2,000 pediatric operations. We continue to condemn these harmful acts which undermine the right to health of the Cuban people. We call on the Human Rights Council to express also its condemnation and repudiation, and to properly defend the human right to healthcare. Thank you.
Thank you. I give the floor to the distinguished representative of Nigeria.
Thank you, Mr. President. Nigeria welcomes this panel discussion on technical cooperation and capacity building in advancing the right to the highest attainable standard of physical and mental health, and thanks the panelists for their insights. Nigeria views technical cooperation as essential to strengthening national institutions, supporting sustainable development, and improving healthcare delivery. In this regard, we reaffirm that such cooperation must be state-led, demand-driven, and aligned with the national priorities and ownership. Consequently, it is imperative to strengthen health systems, build resilient health workforce, and promote sustainable health financing. In recognition of this, Nigeria is implementing comprehensive health sector reforms through the Health Sector Renewal Investment Initiative and the sector-wide approach. These reforms are supported by over $2.2 billion in commitment and seek to expand access to quality primary health care, train frontline health workers, and expand national health insurance to provide affordable and equitable care. These extensive domestic investments underscore our conviction that states bear the primary responsibility for the right to health. Accordingly, national cooperation should therefore complement rather than replace national effort and domestic resource mobilization. Finally, we would like to ask the panelists how technical cooperation can better support developing countries in retaining skilled health professionals and addressing the growing challenge of health workforce migration. I thank you.
Thank you. I give the floor to the distinguished representative of Bahrain.
السيد الرئيس نرحب بعقد هذه الحلقة النقاشية
Thank you, President. Thank you for organizing this very important session. The right to health is inextricably linked to progress of nations, their development, and the need to grant individuals free access to healthcare services. My country, moreover, has adopted a national strategy based on infrastructure development under the aegis of the Health Ministry. We are determined to update and develop infrastructure in a regular manner. We provide financial material support to all venues to be better equipped to provide proper health care to all individuals and to enable that infrastructure to remain commensurate to current challenges. The world today faces major challenges and risk of humanitarian disasters. This means we must all redouble our efforts to ensure cooperation, to provide best conditions for development for all nations at all levels. Thank you.
Thank you. I give the floor to the distinguished representative of Cambodia.
Thank you, Mr. President. Cambodia welcomes this timely discussion on technical cooperation and capacity building in support of the right to health, particularly in the context of persistent global health inequality, emerging health threats, and constrained financing. We believe that ensuring the right to health requires a strong focus on prevention, resilience, and local capacity development. The One Health approach provides an important framework for technical cooperation by recognizing the interdependence of human, animals, and environmental health. Strengthening civilian preparedness and early warning system is vital for anticipating and responding to emerging threats, while ensuring equitable access to the tools needed to protect public health. Meanwhile, certain conditions that undermine the right to health must not be overlooked. Conflict, crisis, and natural disaster destroy infrastructure and disrupt essential services. While disaster cannot always be prevented, many conflicts can and should be resolved peacefully in accordance with international law to prevent the reversal of hard-won development and public health gains. A comprehensive approach that combines technical cooperation, capacity building, peace, resilience, and solidarity is essential to fully realize the right to health for all. I thank you, Mr. President.
Thank you. I give the floor to the representative of UNDP.
Thank you, Mr. President. Decades after the WHO Constitution affirmed the highest attainable standard of health as a fundamental right, the world has more ways to fulfill it than ever before. Life-saving health technologies, digital tools and AI, and decades of evidence on prevention and community-led responses. Yet these advances have not reached everyone, and progress remains fragile as human rights are rolled back, civic space narrows, and countries face overlapping crises. At a time of significant financial pressure and transition, technical cooperation is even more important. It works best when it brings together elements too often treated separately: laws, policies, budgets, institutions, and delivery. This is central to UNDP's work with governments, communities, and partners in more than 132 countries to strengthen inclusive governance and build resilient health systems. We are scaling technical support to ensure that the right to health recognized in law is reflected in budgets backed by capable institutions, community engagement, and services. This means working with countries to align public and private resources with health development priorities, use digital technologies to extend service delivery to the last mile, and strengthen climate-resilient health systems. It also means supporting the policies, financing, and delivery arrangements needed for medicine, vaccines, and diagnostics to reach all people who need them, while removing social and legal barriers, including stigma and discrimination that deepen health inequalities. I thank you.
Thank you. I give the floor to the distinguished representative of the State of Palestine.
Thank you, Mr. President, and many thanks to the panelists for their insightful interventions. As the Deputy High Commissioner rightly said, attacks against healthcare must be denounced. In this regard, we would have welcomed explicit reference in her remarks to one of the most illustrative and devastating examples of this pattern, namely the situation in Gaza, given its scale and severity. Since October 2023, Israel has launched over 1,000 attacks on healthcare workers, patients, hospitals, ambulances, and other medical infrastructure in occupied Palestine, particularly in Gaza, and more than 1,700 Palestinian healthcare workers have been killed. Maternity and neonatal facilities have been directly struck, and medical personnel have faced detention and been subjected to torture and ill treatment. Israel's illegal siege has severely restricted the entry of life-saving medicine, fuel, and equipment, devastating an already fragile system in flagrant violation of international law. Mr. President, technical cooperation and capacity building, however well designed, cannot substitute for ending this pattern of impunity and the removal of the underlying causes of the healthcare system collapse, namely genocide, occupation, and siege. We call on states to support accountability for violations and to ensure that rebuilding Palestine's health system restores not just buildings, but the conditions for Palestinians to fully realize their right to health. I thank you.
Thank you. I give the floor to the distinguished representative of Peru.
President,
thank you. Peru appreciates the fact that you are dealing with this topic on technical building as a tool to make progress in achieving the effective attainment of the right to health. There are tax restrictions, increasing governance, digital transformation. There needs to be a strengthening of national capacities and supporting states in their tasks. For Peru, this includes universal coverage, primary attention, digital health, and protection of vulnerable populations with an intercultural approach. The geographical complexity of Peru, where we have Amazon areas, rural areas, Andean areas, mean that we need to have proper trained staff who can provide culturally relevant services. These aims are linked to our multi-sectoral health policy, the comprehensive health model, including mental health. In this line, we welcome the cooperation that we have for the 2025-2030, as well as working against HIV, AIDS, and tuberculosis in order to strengthen the competences of our staff. Technical assistance needs to be predictable and sustainable, aimed at mobilizing resources, strengthening institutions, ensuring that all this translates into equity, dignity, and inclusion. Many thanks.
Thank you. I give the floor to the distinguished representative of Egypt.
مصر بعقد هذه الجلسة التي تكتسب
Thank you, Mr. Chair. We welcome the convening of this very timely session in light of the pressure on the health sector, such as decreased funding, recurrent health emergencies, impact of conflicts, climate change, and others. Support in the field of health sector should go beyond the temporary support or limited transfer of expertise. We need to be able to mobilize resources, manage health system efficiently, and respond to health crises. Technical cooperation and building capacity should be based on the request of the countries, their national priorities, respecting their national ownership and respecting the various levels of development capacities and resources. We need to benefit from the digital transformation to be able to counter communicable and non-communicable diseases and others. Recently, we have expanded our early detection systems, treatment, primary health centers, and we have gradually endorsed the inclusive health insurance as well as other developments. We would like to say that the standard to measure technical cooperation success is not the size of the resources, but the capacity to leave a long-term institutional impact inside the country. Thank you.
Thank you. I give the floor to the distinguished representative of Malaysia.
Thank you, Mr. President. Malaysia thanks the panelists for their valuable insights. Malaysia firmly believes that the enjoyment of the highest attainable standard of health is a fundamental human right and an essential component of human dignity. Our healthcare system is founded on the principles of universal access, social equity, and community participation, and is underpinned by a strong primary healthcare approach that strives to ensure quality healthcare services are accessible to all. Malaysia also shares the Deputy High Commissioner's and the panelists' observations that the enjoyment of the right to health is increasingly shaped by broader geopolitical developments. Armed conflicts, in particular, continue to have devastating consequences on health systems, including through attacks on healthcare facilities and personnel. In this context, technical cooperation and capacity building are more important than ever. Technical assistance must respond to these realities and support states in strengthening resilient health systems, enhancing preparedness and early warning capacities, and ensuring the continuity of essential health services in times of crises and emergencies. As health systems face increasingly complex and interconnected crises, how can technical cooperation and capacity building be effectively delivered in this context? And what more can be done to ensure the continuity of essential health services under such circumstances? Thank you, Mr. President.
Thank you. I give the floor to the representative of UNFPA.
Thank you, President. UNFPA welcomes this panel on international cooperation and the right to health. As we mark 80 years of the United Nations, the right to highest attainable standard of physical and mental health remains unfulfilled for millions, particularly women, girls, and marginalized populations. The realization of the right to health is inextricably linked to bodily integrity, autonomy, and dignity. Currently, progress is stalling. Every 2 minutes, a mother dies from preventable causes, and 40% of women lack the agency to make decisions about their own bodies. This is a violation of the fundamental principle of equity and the denial of basic human rights. UNFPA maintains that the right to health is universal and non-negotiable. Access to comprehensive SRHR services is not a political option. It is a core constituent of human dignity and sustainable development. Multilateral cooperation is our most effective mechanism for action. Coordinated global efforts have reduced unintended pregnancy rates by nearly 20% since 1990 and lowered maternal mortality by 34% since the launch of the Millennium Development Goals. Together, the international community has also cut the new HIV infection by 43% since 2010. These gains prove that a right-based framework delivers profound progress. UNFPA remains steadfast in its mandate to ensure SRHR for all. We call upon all partners to renew their commitment to global solidarity, safeguard these hard-won gains, and accelerate the realization of health and rights for everyone, leaving no one behind. Thank you.
Thank you. I give the floor to the distinguished representative of Cameroon. Okay, then I give the floor to the distinguished representative of Costa Rica.
Gracias.
Thank you, President. Costa Rica welcomes the holding of this meeting. I'd like to flag the importance of technical cooperation and capacity building as key tools to achieve the effective human right to health. Enjoying physical and mental health is a key right. However, millions of people are still facing obstacles in terms of accessing available health services, acceptable and quality services. Economic and social inequalities, the effects of climate change, human displacement, and health emergencies are increasing gaps, affecting in a disproportionate fashion those who are in situations of vulnerability. In this context, international cooperation plays a crucial role to support states in complying with their human rights obligations. Technical assistance needs to contribute to strengthening solid, resilient and inclusive public institutions that can guarantee healthcare which is based on the principles of equality, universality and non-discrimination. Costa Rica particularly thinks that the initiatives aimed at strengthening primary care are very valuable, particularly in terms of training health staff, mental health and emergency preparedness, as well as responsible use of digital tools, amplifying access to services with a human rights-based approach. Thank you.
Thank you. I give the floor to the distinguished representative of Malawi. All right. I now give the floor to the distinguished representative of Samoa.
Thank you, Mr. President. We thank the Deputy High Commissioner for Human Rights and the panelists for their insightful remarks. Samoa aligns itself with the statement delivered by Federated States of Micronesia on behalf of the beneficiary of the LDC SIDS Trust Fund participating in this session. For small island developing states such as Samoa, technical cooperation and capacity building are essential to advancing human rights, especially as our development challenges are compounded by the impacts of climate change. The Trust Fund is proof that targeted capacity building works. It has enabled countries like Samoa to have a voice in this council while equipping our officials with knowledge and skills needed to serve our people back home, including in the health sector. While Samoa has made important progress in the health sector, our health system continues to face challenges. Non-communicable diseases remain the leading cause of mortality, and many of our people must travel overseas to access life-saving treatment unavailable at home. We also face a shortage of mental health specialists, while gaps in health data collection and reporting continue to hinder effective planning and service delivery. For Samoa, technical cooperation is not just about capacity building, it's about saving lives and ensuring that no one is left behind. We therefore call for stronger partnerships with OHCHR and relevant UN agencies to support the efforts of Samoa and other SIDS in realizing the right to health. Thank you.
Thank you. I will now turn to the list of speakers for national human rights institutions and non-governmental organizations, and I give the floor to the representative of APG 23.
Mr. President, the reduction of ODA undermines health equity, disproportionately impacting vulnerable populations. We are already witnessing the straining of fragile health systems, critical shortages of essential medicines, and disruption to life-saving immunization programs. Crucial initiatives targeting infectious diseases such as HIV, tuberculosis, and malaria are facing severe funding gaps. Health is a fundamental human right and the bedrock of socioeconomic stability. When we underfund global health, we compromise the right to life, dignity, and security for millions. We emphasize the critical importance of the implementation of the right to development as a structural framework to address the underlying social determinant of health. Realizing the right to health is impossible without tackling inequities, environmental degradation, and resource gaps. Moreover, in a era where many states are grappling with debt burden and shrinking fiscal spaces, achieving universal health coverage demands robust international solidarity. Technical assistance must be grounded in genuine partnership, aiding states to implement human rights-based budgeting and secure sustainable domestic funding. We call on the international community to revitalize technical cooperation, not as a charitable gesture, but as a shared human rights obligations. Thank you.
Thank you. I give the floor to the representative of MAT for Peace Development and Human Rights Association.
Thank you, Mr. President. MAT welcomes this discussion and reaffirms that technical cooperation and capacity building are essential for realizing the right to highest attainable standard of health. However, technical cooperation can only be effective if it's supported by sustainable funding and fully respects national priorities and sovereignty. MAT remains concerned about the growing decline in international health aid, as aid cuts by the UK, France, and Germany could contribute to more than 11.5 million preventable deaths in low and middle income countries by 2030. At the same time, cooperation mustn't undermine the sovereignty of developing countries. In April 2026, Ghana rejected a proposed health agreement with the United States due to concerns that sensitive health data could be shared with multiple US entities without sufficient safeguards or prior consent. In contrast, among many positive examples, Morocco's experience in expanding social protection, modernizing health services, and investing in regional development demonstrates how nationally led policies supported by constructive international cooperation can promote equitable access to healthcare while respecting national ownership. Therefore, MAT calls for technical cooperation based on sustainable financing and technology transfer. I thank you.
Thank you. I give the floor to the representative of Peaceland Foundation. Then I give the floor to Asociación P. I give the floor to the Beijing Guangming Charity Foundation for video intervention.
尊敬的主席，农民是全球粮食安全与可持续发展的核心主体，保障农民经济、社会及文化权益，畅通农产品流通渠道，是落实发展权、推进共同发展的关键。当前全球农民在生产技术、市场对接、权益保障等方面仍面临诸支持。北京市光明慈善基金会既有联合国金色理事会特别智商地位，基金会联合世界农民组织聚焦农业技术推广、产销对接服务、国际交流合作等核心方向，为各国农民提供专业技能培训、技术援助、市场信息共享与资源对接，助力提升生产能力、抗风险能力与其发展能力，切实维护农民
as well as sustainable development, and it safeguards the interests of countries. They will. The platform is like a bridge between the market and the peasants to contribute to global food security and to the realization of sustainable development at a global level. Thank you, President.
Or to the representative of Sambali Trust. All right. Excellencies, distinguished representative. That was the last speaker that we could accommodate. I wish to remind you that delegates inscribed on the list of speakers who could not take the floor due to time constraints can upload their statements to be posted on the extranet. I will now give the floor back to the panelists for their concluding remarks. I begin with I give the floor to Ms. Michelle Rem. You have the floor, madam.
Thank you very much. Thank you, Mr. President, and thank you, distinguished delegates. The interactive dialogue has reaffirmed that realizing the right to health requires partnership, inclusion, and sustained action, and that the there's valuable expertise and experience to be leveraged in state health systems that we can continue to learn from. We have heard the importance of country leadership, of responding to country and national priorities, including community priorities, the importance of tailoring technical cooperation and South-South learning in designing more effective, equitable, and people-centered health responses. Communities most affected by diseases, including key populations and women and girls, must remain at the center of these efforts, helping to shape policies and services that respond to their realities and uphold their rights. As health systems undergo rapid digital transformation, we must also ensure that digital innovations and AI do not undermine the right to health. The Global Fund's recently revised digital framework, which has received input and validation from partners in this room, aims to guide the Global Fund Secretariat to leverage technical resources, partners, and support to strengthen our grants. And as we continue to navigate this changing financial environment and increasing pushback against fundamental human rights, sustained financing for innovative and targeted approaches to technical cooperation remains essential. And such support must be tailored, responsive to the particularly community identified needs and national priorities and country contexts. We also highlight and noted the importance of South-South cooperation and peer learning, which we have also found has proven instrumental in sharing practical solutions to remove human rights-related barriers to health services, including through our exchanges between health ministries, national human rights institutions, and other partners. We must also strengthen collaboration beyond the health sector, engaging partners in justice, social protection, gender, and human rights to tackle the barriers where they arise. My last point would be that investments in community-led services and programs that address human rights-related barriers to health should also remain a priority for donors, for technical partners, and for states. This is particularly important at a time of constrained resources to ensure that available funding is used strategically and efficiently, delivering maximum impact while reaching those most affected, most at risk, and also sustaining access to essential health services. Together, these approaches can build more resilient, inclusive health systems and help ensure that everyone, especially those most affected by HIV, tuberculosis, and malaria, can access quality health services without discrimination, stigma, or exclusion. Thank you.
Thank you. This brings us to the end of this panel discussion. I wish to thank the Deputy High Commissioner, our distinguished panelists, and all the participants who have contributed to our discussion. Excellencies, distinguished representative, this brings us to the end of our public meeting. We will hold our next public meeting tomorrow morning at 10 a.m. to hold the urgent debate on the human rights situation in and around El Obeid, North Kordofan, in the context of the ongoing conflict in the Sudan. We will now take a short break before the closed meeting in relation to the complaint procedure of the Human Rights Council. The closed meeting will be held in person in the Assembly Hall. Only members of the Council participate in the meeting. No webcast or recordings will be provided. And I kindly invite all observers to leave the room. Thank you.
you.